Hello. Welcome to our channel dedicated to men's health. You're probably here because you're about to undergo prostate removal surgery, or maybe you just want to understand more about how this stage of life works. In any case, I'm here to help you clarify all your doubts and reassure you. I know that thinking about surgery like this can be a little scary, and it's normal for you to have a lot of worries running through your head right now. But take a deep breath, as information is the best way to dispel fear. Let's explore all aspects of the post-operative period of prostate surgery together, from initial care to complete recovery. And look, I'm going to do this in a very simple and direct way, as if we were talking face-to-face, because I want you to understand every bit of this recovery journey. No complicated terms or explanations that seem like something out of a difficult-to-understand medical book, okay? I want you to feel comfortable and prepared for what lies ahead. Prostate removal, also known as prostatectomy, is a very common surgery, especially in men who have been diagnosed with prostate cancer. But this surgery may also be indicated in other situations, such as in the case of severe problems with the prostate gland. The good news is that advances in medicine have made this surgery safer and more effective than ever. Even so, it is super important to know what to expect after the operation. Recovery can be a different process for each person, with some days more challenging and others calmer. What matters is that you are well informed so that you can deal with any situation in a calm and controlled manner. It's like when you go on a trip. The more you know about your destination and the path to get there, the fewer surprises and setbacks you will encounter along the way. Here, the idea is the same, to guide you through the entire post-operative process, explaining what is normal and what is not, what you may feel and how you should deal with these sensations. For this recovery to happen in the best way possible, it is essential that you understand the steps and care needed post-operatively. So, stay with me until the end of this video. After all, what exactly is prostate removal surgery? Well, the prostate is a gland that is part of the male reproductive system and is located just below the bladder. Its function is to produce part of the liquid that makes up semen. When problems arise, such as prostate cancer or excessive enlargement of the gland, it may be necessary to remove it to preserve your health and prevent serious complications. This surgery is called a prostatectomy. There are different types of prostatectomy, but they all have the same objective: to remove the prostate safely, ensuring that the patient is free from the problem that was causing damage to their health. Now, you may be thinking, what happens to my body after the prostate is removed? This is a very common question, and I'm here to reassure you. The good news is that many men undergo this surgery and live completely normal lives after recovery. However, in the period immediately after surgery, the body goes through some adaptations. The healing process begins as soon as the prostate is removed, and you will be closely monitored by medical staff at the hospital for the first few days. The focus here is to make sure your recovery is going well and that you don't have any complications. You will notice that there is a lot of effort put into ensuring everything runs smoothly from the start. But it's important to understand that this is just the first phase of the recovery process. After undergoing surgery, the doctor will place a catheter that will be connected to your bladder for a few days. This catheter serves to help drain urine, as the muscles and tissues around the area that was operated on need time to recover and function normally again. It may seem strange or uncomfortable, but the catheter is temporary and helps a lot at this critical moment. Once your body is ready, it will be removed and you will be able to urinate normally again. During this period, it is important to follow all of your doctor's recommendations, such as taking prescribed medications to relieve pain and prevent infections, as well as resting as much as possible. This rest is crucial for your body to recover efficiently and without rushing. Don't worry, you don't have to go through this alone. The entire medical team will be by your side to ensure this process goes as smoothly as possible. As the days go by, you will begin to feel improvements. But it is essential to remember that complete recovery takes time and patience. This is where many people become anxious, wanting to quickly return to normal activities. The secret is to respect your body's limits. Taking light walks, avoiding carrying weight, and maintaining a healthy diet are some of the guidelines you should follow. Additionally, your doctor may suggest specific exercises to help you regain strength in the muscles that control urine. This is a very important point, as at first you may feel some difficulty holding back urine, which is absolutely normal after a prostatectomy. But with time and these exercises, this function should return to normal. The important thing is not to despair and know that this is all part of the healing process. After surgery and removal of the catheter, it is common for you to feel some changes in your body. One of them may be the temporary loss of control over urine, called urinary incontinence. This happens because surgery can weaken the muscles that help control urine flow. But don't worry, this tends to improve over time. What helps a lot in this process is performing simple exercises, such as the famous Kegel exercise, which strengthens the pelvic floor muscles. These muscles are essential for controlling urine, and the stronger they are, the faster you regain control over your bladder. Be patient, practice these exercises daily, and you will soon see positive results. Another common concern after prostatectomy is sexual function. Many men report difficulty getting or keeping an erection after surgery, and this can be frustrating. This difficulty occurs because the nerves responsible for erection can be affected during surgery. But just like recovering urinary continence, sexual function can also improve over time. There are specific treatments, such as medications or therapies, that can help in this process. The most important thing is to maintain an open dialogue with your doctor about these issues, so that he or she can best guide you. Remember, each body is unique, and recovery may vary from person to person, but with patience and medical support, it is possible to return to a satisfactory sex life. Another issue that tends to make men worried is sexual function. After prostatectomy, some men may have difficulty maintaining an erection. This happens because the nerves around the prostate can be affected during surgery. But don't worry. In most cases, this function returns to normal over time. There are treatments and medications that can help with this process. And the important thing is to talk openly with your doctor about this. Sexual recovery can take time, but with patience and the right care, most men can get their sex lives back on track. In some cases, it may be necessary to use medications or therapies to help with the process, but your doctor will guide you through each step. Now let's talk about home care. After being released from the hospital, his recovery continues. You will need to follow a lighter routine, avoid physical exertion, and prioritize rest. Walking is an excellent activity to help with blood circulation, but always respecting your body's limits. No weightlifting or activities that require a lot of effort until the doctor approves it. Furthermore, a healthy diet is essential for a good recovery. Eating foods rich in fiber, proteins, and vitamins will help the body recover faster. Drinking plenty of water is also essential to keep your body functioning properly. And of course, strictly follow the instructions regarding the medications your doctor has prescribed. Finally, I want to reinforce that the quality of life after prostatectomy can be very good. With adequate care and correct medical follow-up, many men are able to regain their health and return to their normal activities. The post-operative phase may seem challenging, but with patience, care, and correct information, everything will be fine. So, stay calm and follow your doctor's instructions. This video was made to inform and reassure you about what to expect at this stage. Leave your like, share this video with your friends, and don't forget to subscribe to our channel to receive valuable content about men's health and urology. Thanks for watching, and see you next time.